Chairman, I'd like to also thank you for holding this important hearing. And I was a small business owner myself with about 150 employees, and I've seen the value of empowering patients to have as much say as they can in their own healthcare choices, and I've seen how that can help to reduce costs and improve outcomes. And I also developed a real frustration when red tape or regulation, whatever it may be, in our healthcare system got in the way of the delivery of the services or got undermined patients' abilities to make their own informed healthcare decisions. So again, this is a great hearing today. I'd like to specifically talk about that in the context of direct primary care, which I appreciated Mr. Blumenauer's comments on that earlier today. It's a bill that we're working on together. And it's important to me because I've seen the impact in my community where different groups, whether it be business owners who are providing the services, have really used this innovative payment model to really make a difference in people's lives, better access to that primary care when needed, sometimes bringing people or encouraging people to get care earlier, which sometimes can have a real impact rather than letting a condition get worse. So again, I think folks know, but just reiterating, this is a monthly fee that is being paid to doctors for a suite of primary care services rather than paying a fee for each service. So patients like it because they get reliable, high-quality preventative care that keeps them sometimes out of higher-cost sites of care like the emergency room. They also know exactly how much they're going to pay each month for that if it's not being paid for by their employers. But employers like it because investing in that preventative care for employees helps them to be more healthy and also then more productive. And I think in my community, at least doctors like it because that monthly payment structure means they can spend less time coding for services and doing what they really want to do as doctors, spending time caring for their patients. And so this current IRS rule that prevents 32.5 million Americans with a health savings account from participating, from using those funds to pay for direct primary care, I think is something that it's a small fix that I think would benefit a lot of people. And that's why, as I mentioned, I'm proud to work with Mr. Blumenauer. Ms. Tenney, I think, talked about it as well, Mr. Schneider, on the Primary Care Enhancement Act, H.R. 3029, which would fix that gap in our tax code and expand access to direct primary care. The legislation has been favorably reported by this committee on a bipartisan basis in primary congresses as well. So hopefully this is the session that we can fix this. Mr. Short, employers offering direct primary care report savings of over 22% or 20% in some cases. And I wonder if you could just talk a little bit about that, explain how it can both reduce costs and also improve health outcomes for patients.
Absolutely. Even in my company, we offer and pay for direct primary care for the very reasons of savings we've been able to uncover by having the program in place for now over 8 years. And the simple fact is we're able to incentivize the healthcare providers and the direct primary care physicians to take an active role in the preventive medicine of our employees and their families. And by getting them actively involved, where actually their incentive is to keep people healthy versus a fee-for-service world where they make money when people are sick, we have seen the actual results come through in avoiding larger claimants, where diabetes is a great example. If we can get a hold of diabetes first before it becomes an issue with metformin and other processes, we can save money for the plan, and we're seeing that in real life. We saw it in the Milliman study as well, and we're seeing it across the country.
Do you see any reason why patients with HSA should not be allowed to partake in direct primary care?
I see no reason. It seems like common sense.
Yeah, and can you explain why direct primary care it's not health insurance, and the IRS at this point is treating it as such? Can you explain that?
Yeah, so direct primary care is a set of services very focused on primary care, while insurance is a global coverage for multiple things beyond just primary care.
Thank you. Thank you, Mr. Chairman.